Hey everyone, welcome. I'm Scotty Sims, the Executive Director of KCNQ2 Cure Alliance. I am glad everybody was able to join us tonight. Whether you're joining as a parent, a caregiver, clinician, or supporter, we know that being part of our community often means a lot to navigate. If you're learning about rare disease, searching for answers, and trying to connect research, care, and everyday part of your life. And that's why we're excited about this webinar, which is all about tools that can actually help us in day-to-day ways. These are tools that I actually use myself for our daughter Harper. So this is something I think has the potential to be really helpful for people. We're hearing from the team at Citizen Health, who's doing some incredible work and supporting other rare disease communities. And we've been working with Citizen Health for, gosh, I don't know, I feel like 6 years now. And they're building technology designed to help families better understand the condition that we're struggling with and how it presents in our children and loved ones, and how to organize this information and how we can stay informed about research and opportunities that matter. And we'll also touch on some things really important for the future of rare diseases, which is, and this is really big, and we say this so much repeatedly within our community, how important it is for our families to sign up for a CRID, which is a common rare disease identifier. And this is a unique identifier that is assigned to your loved one. And anytime they or you participate in their behalf in research, if there's a place asking for a CRID or a unique identifier, you need to add that, because what it does is it links everything that your child participates in together. So if you participate in some research over here and something over there, it will link those, and it helps us get a better picture of our community, because we know that all this information connected to this one ID is on one specific person, and we get a really, and researchers get a really kind of clear image of what that looks like. And it's all de-identified information, which is why you have this unique identifier. So I want to welcome tonight our speaker, Jeffrey, or he goes by Geo Beek, who's the head of partner management at Citizen Health. Geo is a certified genetic counselor with over a decade of experience supporting families navigating pediatric genetics and rare diseases at institutions such as the Mayo Clinic and Children's Hospital, Minnesota. He now works closely with advocacy organizations like ours to help ensure patient voices and shape the research that matters. So we'll start with a quick overview, then we'll move into a live look at the KCNQ2 AI Advocate, and then we'll leave plenty of time for Q&A at the end. And I want to thank you all for being here. And we'll begin with just a few quick little housekeeping. Just keep your microphones on mute once the presentations are over, and we open for the Q&A. And you can actually do this at any time, but you can type questions in the chat. But if you have a question where you want to ask live, you can do it at the end of the presentation. Just simply use the reaction button and raise your hand, and I'll call on you when it's your turn. And with that, I will turn it over to Gio.
All right, thanks, Scotty. Whenever you read someone's bio, it feels fancier, I feel like, than it actually is. But really, my experience is that I started clinically as a genetic counselor and really focused on rare diseases. And then since have moved into lots of different things at Citizen. So I've worked on our data team, like responsible for actually curating medical records. I've worked with partner management across pharma and advocacy. And so I'm super excited to tell you guys a little bit about Citizen and what we're doing, and hopefully about how we can help your community with research and rare disease care moving forward. A little bit about Citizen, if you haven't heard our story before, this is a picture of Nasha Fitter. She is one of our co-founders and chief business officer, and her daughter Amara has FOXG1 syndrome, so a rare neurodevelopmental condition. And shortly after she was diagnosed, Amara, like many parents, was kind of thrust into this caregiver responsibility. And she quickly realized that for rare diseases, the system is not really built for rare diseases specifically. And what she was really looking for was more personalized care. And on top of that, with any rare disease, really what we're trying to do is we're trying to come up with better treatments and better cures. And part of the frustration of that for Nasha was how long it takes to develop treatments and how expensive that can be. And put that all on top of just the burden that rare diseases place on families, not just from a research perspective, but from a day-to-day perspective. So at Citizen, what we're trying to do is to create something that solves all of these problems simultaneously. So first, understanding that even participating in research has historically had a very high burden on patients. Once we have data, we see that it is oftentimes fragmented. And as we were talking about the CRID identification numbers, like that is one solution to that, is finding a way to bring data together. And then lastly, that most of the solutions that have been developed are not specifically for rare diseases. So we're hoping to try to solve all three of those problems at the same time. And really, this is a relatively simple way to say that what we're designing is something that's specifically for rare disease patients and families because we know that you guys are kind of the key to this whole thing. If we're building something that doesn't support you in a day-to-day and doesn't support your needs, it's not going to work at all. So what we do at Citizen is really we're trying to create a platform that addresses all of these things. The first thing we do is we try to get all of your data into one secure place. And when we have that data, we then want to try to make available personalized insights that can support you along your journey. And we do that with lots of different tools, but kind of the biggest one that we're talking about tonight is our AI advocate that we specifically built for rare disease communities. And while doing all of these things, the ultimate goal is to power research. And we want to make that movement of research forward, we want to make that as low a lift as possible for families. So specifically how this works at Citizen, the first thing that we do when patients sign up is we collect all of your medical records from every single institution, every single doctor, every single provider across the United States. And we put all of those records into one secure portal that you have full access to. Once we have those records, we use an AI advocate that allows patients to ask questions about their records or caregivers to ask questions about their children's records. And that can be simple things like getting a list of symptoms or a list of medications, or it can be more complicated, like preparing for medical appointments, writing insurance appeals, all of those kind of those things that take time. And then lastly, we want to make sure that patients are given the opportunity to participate in research. And if a patient's data is used for research, we also think that it is important that they're compensated for that. And so to date, through our different research partnerships, we've compensated just over $1 million with different rare disease communities. In the top right here, this is Devin McGraw. She is our Chief Regulatory Officer, and I always like to bring her up because she's kind of a famous person in the regulatory world. She worked for she was a former HIPAA officer, so actually wrote a lot of the HIPAA laws that we know today that are all about protecting patients in terms of medical records and their data. And so, kind of the core principles that she's really had for Citizen as an organization from the beginning is that patients control their data. End stop. Patients have control over how their data is being used. And if patients agree to use that data for research, it is our responsibility to make sure that that data is secure and always de-identified. And then lastly, as we talked about, the piece of compensation when we're able to use that data for research. Moving into actually kind of what this looks like. So first is for your group, we have a custom landing page. So this is a kind of co-branded page where you can go and sign up for Citizen. You see right in the top, it's pretty easy. And this process is really quite simple. I don't know if there's anybody on the call who's done this. I'm sure a few of you have, but we wanted to make sure that this part is not a hurdle. It takes about 5 minutes to create a username and password and to enter some very basic demographic information. And then you are asked two consent questions. The first one is, do you want to share your information with the advocacy group? So do you want to have that ability to stay connected? And then the second question we ask is, do you want to use your de-identified data towards research? I want to emphasize that patients can come onto our platform, choose not to share anything with advocacy, choose not to put their data towards research, and you still have the same experience. We'll still collect medical records. You can still use the AI advocate, all of those things. And these are questions that you can change or consents that you can change over time as well. Um, Past consent, we then ask you to enter all of the providers or the places that you've been seen, and then we ask you to validate your identity, which is usually uploading like a picture of your driver's license to prove you are who you say you are. And then we use that to go out and collect all of your medical records. So this is just a screenshot of what the dashboard looks like when you log in, and we'll go into this in a little more detail. But again, once you've completed that onboarding step, the record collection is at no cost. Once you have medical records in your citizen profile, you can share those with whoever you want, whenever you want, and that is all through a secure portal. And then you can also elect to participate in research without ever having to leave your home. You get access to the personal AI advocate, and again, access to the revenue share. So the AI advocate, we this is a relatively new thing for us. This was released to the public back in the summer of last year. And really, I think everybody is starting to use AI in different parts of their life. And so what we wanted to do is try to capitalize that and find a way to use AI to relieve burden from patients and from caregivers. So there are lots of different ways that we have intended for this to be used, and we also see that caregivers use this in many ways that we never expected. So I think that just shows that this is something that's growing, and we're continuing to see it used in different ways. But in some instances, it's very simple. We will see people go into the AI advocate and ask, can you just provide a summary of my child's medical record or of their medical history based on all of their records? Or sometimes we have more detailed questions. What are other treatments that we've seen for patients across this population? Or can you help me interpret a lab result or a genetic test result? Or can you help me get ready for a next appointment with somebody new? All of these are things that we've seen people using the AI advocate for. We've also had some really great feedback so far. So this first example was a parent who had used the AI advocate to write an appeal letter. So this was specifically for an adaptive bicycle that had been denied multiple times by insurance. And the AI advocate was able to pull specific details from the medical record to really support that denial letter and was able to overturn that denial. The second example here is one that I feel like I'm so familiar with, which was these binders full of medical information and understanding that even if you have everything there, it's hard to remember, when a certain medication was started or when did I have that conversation. And so, um, what we see people being able to do is to use the AI advocate to ask very specific questions about their medical history and to be able to provide that in instances like unexpected visits to the ER when you're on vacation or longer hospital stays where you just don't have time to think about all of those details. The AI advocate can kind of take over and relieve some of that burden. And then the last example was someone who was filling out a questionnaire where I think it was like 50 or 60 questions that got more and more specific. And at some point, it was taking, minutes and minutes to look through medical records to find these answers. And so that parent ended up just using the AI advocate to say, like, this is the question. Can you tell me what the answer is? So kind of some really, really cool examples of real world examples of the way that people have been using this. And this is actually already outdated. It says coming to your pocket soon, but this is actually live now. And which is to say that we now have an app for iPhones only right now. So you can go to the Apple Store and download the app. It's a slightly different experience than just accessing the citizen profile from just a web browser. Um, but this is something that just happened about a month ago where this came out. From the app, you can still use all the same features like of the AI advocate to prepare for medical appointments, to keep track of symptoms, but also we have some additional features. So one thing we have is the ability to record doctor's appointments. So that's kind of a recording feature that we have. Just let this play out here. I believe we have that in another slide here, but just to say that if you want to access this, you can always access it from the web, but also we now have an app available, which is kind of cool. Do you want to highlight that we do provide support for international patients as well? Unfortunately or fortunately, the way that we use or the way that we collect medical records is specific to laws and legislation in the US. So that doesn't work the same across other countries. However, we do have onboarding translated to six different non-English languages. And for international patients, they still have the ability to upload their own medical records and take advantage of all of the other features that we have on the Citizen platform. Okay, so a demo. I have kind of two different ways we can look at this. This is more of a screenshot demo from Nasha's daughter's account, which I think is helpful from like a caregiver perspective. Afterwards, if you'd like, I can pull up my actual account and we can just look at what it looks like live, kind of in real time. But I'll draw your attention to a few things. So first on the left side, we have kind of first our dashboard, which gives you access to all of these kind of common uh, questions or common things that we want you to have access to. You can click on the medical records page and it will bring up all of your medical records organized kind of based on where they were requested from. And then there is a survey option as well. So advocacy groups can design surveys that can be assigned to their groups. We can also have surveys that come directly from Citizen, but this is a place where we can also do things like collect grids, which I believe is how this is set up for your community, where you can go in and respond and provide that information. And that's really critical because one of the problems with any type of rare disease research is this data being everywhere and trying to find a way to harmonize those data sources to link them together. And the CRID is kind of a magical piece that allows that to happen. So looking when we these different boxes we have here, these are all using our AI advocate. And these are just questions that we either kind of designed at the beginning as good starters. If you're unfamiliar with AI or less certain about how things work, these are kind of good starter conversations. But you can also just free type anything. You can literally ask any question about your medical records, and it will try to answer those questions for you. But I'm just going to go through a couple examples. So the first one would be getting ready for an upcoming appointment. When you click on that, it kind of starts the prompt and it says, okay, getting ready for an upcoming appointment. A couple questions. Who is the appointment with? And you can see here that Nasha says this with Dr. Porter, our neurologist. Can you look at notes from her last appointment and help me prepare for this one? Amara is still having seizures despite new medications. And what the AI advocate creates is this kind of massive list. And I think this is probably similar to so many lists that I saw from parents in clinic, which is to say these are questions that you're thinking about, but sometimes you may not have the time to get all of these ready, or you may not know the exact way to ask these questions. So what the AI advocate is able to do is to kind of pull those specific details from medical records and provide really direct questions, which I think is a pretty cool way to interact. We also have an option of kind of just getting some basic explanation for a disorder, which is helpful. So you can see here it says, I'm going to provide a visual explainer for FOXG1 syndrome, which is again the condition that Amara has. And then when we go into this, it kind of provides this relatively detailed explainer of what FOXG1 syndrome is. And it talks a little bit how it may affect Amara's daily life. It provides some interesting details about what Amara is like as a person, which, believe it or not, these are details that exist in the medical record. It's not always specifics of medication and treatments. Like there are additional things there that become very valuable for understanding a person, not just because of a rare disease, but because of who they are as a person. And then it provides some interesting insight into how you can interact or what you should need to know about safety around them. And then it provides this kind of important message, which is to say that we want you to recognize Amara first. FOXG1 is part of her life, but that doesn't define who she is. So I think it just really is a good way to ground information about who this person is. I'll highlight the prepare for an insurance appeal as well. We've talked about that briefly. Um, but it'll ask you for some very specific information. So what's your insurance name and plan? What was denied? What are some of the relevant details? Are there any key dates? And then what type of appeal are you filing? You can answer as many of these questions as you want, or you can not. If you don't know the answer, you can leave them blank, and it will still work to create these documents. But we can see here in this example, we're saying has a PPO, was denied for an adaptive bike. It was stated that weakness in muscle tone was not enough of a reason to grant her a bike. Can you please go through records and rewrite this appeal? And this is what we get, which we won't go through this whole thing, but this is to say that this is like a very robust, complete appeal letter that could be directly sent to insurance. I love how it pulls out specific information from the medical record and really defends why these decisions are being appealed. And I think it uses language as well that is matches what we would either see clinically when we're submitting these, or at least something that an insurance provider would be familiar with seeing. But again, the crucial part here is being able to pull those very specific details from the medical record. And then the last one I'll highlight is just the view of a symptom timeline, which I think in some ways is relatively simple, but in other ways provides really kind of a great commentary on the trajectory of diseases over time. I think you may not remember, all of the different dates that are associated with changes to certain pieces, whether that's epilepsy or movement disorders or medications. But it allows you to kind of provide highlights of all of those different areas chronologically. And this is again just another breakdown of what that chronologically can look like more over time. Okay, so this is I'll just start playing this here because it's a little bit long, but this is actually, a video recording from the app when we're recording an appointment. So it asks you some questions. What type of visit is this for? Asks if it's an in-person or telehealth visit, and then it gives you some instructions to make sure that whatever device you're recording on is able to pick up the conversation. And then once you start recording, you'll see the timer start ticking, so you know that this is active and working. I'll give it just 1 second here. So once you actually start speaking, it starts showing kind of the waveforms in the audio file. So you know that people are talking, you know that it's picking up the recording. Um, and it also will start analyzing speakers as well. So you'll see here in a second, speaker one, who is this? This person, speaker one in this instance is the doctor. So you can label that person. Speaker two is the patient or caregiver, me, which allows you to put in that information. And then every time that person is speaking, it will label them appropriately as who that is. I'm going to skip forward a little bit here because it's just kind of talking about details. But again, it provides that whole back and forth commentary that's happening throughout the appointment. And then at the end, oh, sorry, we're going to slide back just a little bit. Once you're done, you can hit this either pause if you need to take a break or stop the recording. Um, And then it gives you this option if you want to discard the recording, if you want to save it, how you want to use that later. Um, and then it also will, once you're through this, it will automatically go into the AI advocate for you with the recording, and it will provide a summary of that doctor's visit. You can also then ask questions about that summary or ask for the summary to be written in a different way. It's the kind of same AI experience, but in this instance, it's specifically using the recording from those visits. I do want to note that one small difference is that we do have a prompt at the beginning now that we ask you to ask the person you're meeting with if it's okay to record. Because there are different laws in every state about one party recording or two party recording. And so we think it's important that we're covering all our bases and making sure that if you are using the recording feature, that you're asking that person if they're okay being recorded. Just to kind of double click a little bit more on privacy and security, and I think it's especially important when we start talking about AI, is again just emphasizing Devin and her role with our organization. This kind of goes more deeply into her experience with HIPAA laws, and all of her accolades. But I think Devin is someone who's literally been with Citizen from the very, very beginning, and continues to be one of our North Stars in making sure that whatever we're doing with the data, we're handling it as securely as possible. Um, let's see here. So specifically for AI Advocate, a couple notes on privacy. So we are using your internal medical records to respond to the AI Advocate. All right. We are not sharing your conversations that you have with the AI Advocate or any questions. If we were ever going to do that, it would only be with explicit consent. So we would talk to you before we ever went there. And also importantly, we are not using data to train any third-party AI models. Like everything that we have built at Citizen is secured inside of the Citizen platform. And so again, this is very different than just using Chat GPT and going out and putting information in. It can provide similar things, but what we're trying to do is to make sure that everything that we're building is literally as secure and safe as possible. Additionally, when we kind of compare the AI that we've created and comparing it to other AI models, we have specifically designed this to support rare disease families. So not just to provide information about looking at medical records, but specifically for rare disease families, which I think makes it a little unique and a little more specific. And it really is still powered by your information. It's powered by your medical records. It just is a easier way for us to ask questions about those medical records, a more efficient way for you to ask questions about your medical records. And lastly, we are always kind of evaluating the different models that exist. And oftentimes those models require subscriptions or payments to use them. And that's something that's all we take care of internally. But what it means is that we want to make sure that we're providing you with the best possible experience, the best possible AI models for answering these types of questions. And then to briefly talk about research, so we have a couple kind of recent wins that I wanted to bring up. The first is related to some work that we're doing with the FOXG1 Research Foundation. So they were needing to characterize disease progression. They wanted to select endpoints and design a prospective um, gene therapy trial for FOXG1, and they specifically use citizen data to build those endpoints and to help design that IND or design that gene therapy, which was just awarded this IND clearance earlier this year. So it was kind of a really cool experience for us to show the way that our data can be used to help move the needle forward for rare disease treatments. And then the last one is just a publication that we did in Brain just a couple years ago where we were using kind of an extended natural history data set from patients with STXBP1 related disorders to try to provide a better understanding of what that disease looks like. Um, and so if needed, I can certainly share that publication, but was really kind of impressive in the number of patients and the detail that we went into with that data. So the last thing I think is really just an opportunity to ask questions, um, an opportunity to talk about like if there's anything else that you need to know about sign up. I did include a QR code here, which will take you directly to the landing page. Um, that's more just to save some time if you're interested in doing this. Um, but also our support email address is kind of the best way to get in touch with all of us, and that's me included. If you have questions that you want to ask later or you want some time to kind of think about those things, you can always send us an email there. Um, but otherwise, I think I would just kind of like to open it up and see what kind of questions y'all have.
Gio, thank you so much for that. I appreciate that real informative kind of overview. I know Brooke had a question and wanted to ask hers. Brooke, do you want to introduce yourself to everybody?
Sure, yeah, happy to introduce myself. And I do see some hands raised out there, so happy to get to the community as well. But I did want to introduce myself quickly to those who may not know me. I'm Brooke Babineau, and I am the scientific director of the KCNQ2 Cure Alliance. I'm very happy to be with the group and with them a little over a year now. And so, yes, thank you so much, Gio. Citizen Health is a really amazing platform. Obviously as a scientist, I see its power maybe in a slightly different way, but I'm also a parent, and so not fully understanding what all you have to deal with on the medical side. I hope that this can also be just a functional tool as well. While I ask my question to Gio, I wonder if in the chat, if people don't mind, I'm just really curious in the community, like if you don't mind maybe putting in like I already use Citizen Health or but I'm interested in AI Advocate or like what brought you here today, right? Like are we always already familiar with Citizen Health as a platform but interested in the new tool, or are you new to Citizen Health and we're sort of curious about it? I'm just sort of curious how we're using it. But Gio, my specific question was around the information source, and you touched on it, right? That and you saw with Amara, like there was just such deep rich information about her and her experience, but I also saw in some of the other examples, like it was about, is Medicaid going to cover this?
Mm-hmm.
Where's that information coming from? Is that being queried from external sources?
There is some there does have the ability, the AI advocate does have the ability to go to external sources to pull information like that. We also have internal sources that we have curated to answer a number of more specific questions. Of course, we can't prepare every possible question, so we have to have a way to do that. We also have um, guardrails on what the AI advocate can and can't do. So, pretty specifically, we want you to be able to ask questions about your medical record, but we don't want the AI advocate to provide any type of medical advice. We don't want it to try to replace a physician or to try to replace a genetic counselor. And so you'll see that if you try to push it and ask some of these questions, it will say, this is a great question for your neurologist, or you should consider asking this to someone because this is outside of my scope. So, lots of different ways that information is kind of pulled in.
That's really helpful. That makes a lot of sense to kind of populate it with just what feels necessary and useful, and also having that sort of hard line of when like you need to reach out for more. So thank you for that,
Right.
and thank you for the responses coming in. I'll turn it over to Scotty. I don't know if you want to moderate with the hands raised. Go ahead.
Yeah, I see, I think one person with the hand raised named Marissa.
That's so
Do you want
strange.
yeah,
Yes.
it's just the link issue we had, but if you could say who you are and then ask
Yep.
your question, that'd be great.
Yep, that's it. Yeah. I'm Penny Harrison, and my son is 19 and has the KCNQ2 gene mutation. And we've been uploading the information for a couple of years now. And I was curious, I noticed that the information isn't that current. So do I need to like periodically go in and say, hey, Gillette Children's, please send over new records? Like, is that
Mhm.
just something? And how often should we do that?
That's a really good question. So we try to update medical records requests over time, especially as additional research or additional opportunities are happening for a specific disease group. At any time, you can go into your record and refresh a request. So that is something that different groups have different cadences, but I would say that's something that at least annually is worth doing. Um, and that also gives you a chance if you're seeing new doctors, like that's a good opportunity to say, oh, remind myself to add on that new person to make sure those medical records are getting pulled in. So I would say that, yeah, roughly every year is a good benchmark, or every time that something new comes up and you want to see those records in the system, you can always update the request.
Can I ask one more question?
Of course.
What if we see multiple providers at one organization? Do I have to put every single doctor's name in?
That's another good question. So you can, or when you start putting in a request for a provider or a request by institution, it will
Hmm.
provide a big drop down. So if you start saying Gillette Children's it will give you the different options that you can select. And in some cases, it may be, different clinics across town. In other cases, hospital systems really have all of their medical records under one umbrella, so we can put a request to one place and it gets them all. I would say that you just really need to kind of feel it out. The
Hmm.
other thing we do is when we actually have people who are going through and abstracting data from medical records, we are able to identify if things are missing. So that happens all the time where it says, "Oh, patient was seen by Dr. So and so," and that person that's looking at those medical records says, "Well, I haven't seen any notes yet from that doctor. I wonder if they're missing." And in those cases, it even allows us to reach back out to you as caregivers and say, "Hey, what about this person? Would it be okay if we start that records request for them to make sure we have all of those data points?" Because we really are trying to build a robust data set, and that we have very strict kind of criteria for if something is missing or if how important that is to the story to make sure that we have everything.
Okay, thank you.
And Penny, I want to say that like our daughter has an appointment tomorrow for her, annual pediatrician check-in. And so I just kind of make it a habit of going in and requesting the citizen the records a couple days after appointments. Or if I get behind on that, I just set a reminder that I go in at least every 3 months to do it. Because sometimes if you're dealing like her pediatrician is at a little bit of a smaller practice, but they still use my chart. So it might take longer for the records to come versus like Children's Hospital Colorado, where they get them a lot quicker. And then, we go in and we'll send reminders out, the foundation through Citizen to families like, you might want to, upload your records and do kind of a check-in. So you can also be on the lookout for that to make sure like Citizen is um, doesn't go to your spam email. And to that point, also, we created a CRID survey, and that's how we are able to get this unique identifier connected to our children's records. So every couple months we go through and we send the survey back out, and it literally is just like, do you have a CRID? If you do, put it in. If it's already in, move on. If you don't know how to do it, click this link. It'll create a CRID for you in 2 minutes, and then you can put it in. um, so there's a lot of reminders and prompts that come through, so you can also just, like I said, make sure that anything coming from citizens not going to your spam, and we will provide you with the reminders. One question that I received, Geo, was as far as how, I guess, as far as like international families is one of the big things, because we have, and that's the big thing we have asked for from the beginning, is how does this impact? And I know that that's something that's in the works. But it's, when you're dealing with different countries and languages, that kind of can make things go a lot slower. But as far as our families in English speaking countries, can you kind of speak to what options they have, or people in other countries kind of explain about uploading records and how that works?
Yeah, so I think that actually we can talk about international countries and languages all together because everything we see works actually the same. Like the AI advocate in terms of how it reads medical records, it's really good at non-English languages. We've seen that it can struggle with like character-rich languages. Like Chinese can be a little more challenging, but even then, like the responses are very, very good. But more specifically for patients outside of the US, you can upload medical records yourself directly to your Citizen account. So that usually means that you have to have those, in a PDF or some type of electronic format, which is in some places easier to do, in some places harder to do. We 100% recognize that it is more difficult for international patients to have that responsibility. And we are actively working on ways to try to address all of the different countries. But it's kind of one of those things that the problem gets complicated really quickly because every single country has different rules. But what I would say to international families is that even if you have a hard time getting all of your medical records uploaded, if you are specific and say, like a genetic test report and maybe the most common specialist that I'm seeing, even having that information there allows you to take advantage of the AI advocate, allows you to continue to share those medical records with other people. So I think the experience is slightly clunkier, but still is very much available for even patients outside of the US.
Great, thank you. Lisa, I see you have your hand up.
Yes, hi. Thank you, everybody. So I have a question that I'm not sure you can answer, but I'm going to throw it out there. So my son is 26
Okay.
and he is in a residential placement in a group home.
Hmm.
And while I plan to be around for many, many years, I also am thinking about what's happening if I am not able to be the supplier of all things William, my son.
Hmm.
I have written, I have compiled, I have copied, I have done like what everybody has done on here. And I still find that there are gaps and there are things that only I know and I have locked away in my history with my child.
Hmm.
How could I utilize citizen health to help the group home? And that I just see a really huge opportunity here because I see what I go through with the residential provider every time that my son has to go to a provider, a doctor, a neurologist, anybody. And
Hmm.
while I have done my best to give a history, I, may not be around sometime. And how can I utilize your services and incorporate that into his residential life with and maintain, I hear the HIPAA, I hear the challenges here, but there's
Right.
also such a tremendous need for this understanding to take place so that they can take charge. So how do you do that?
Yeah, I mean, first, I don't know the answer to that question, but I have some thoughts. I mean, there are easy ways to do it to continue to provide information using AI, using the AI advocate to these facilities to make sure that they know about updates. And I think one of the keys, like when we were looking at that Fox G1 caregiver guide, like that is completely customizable. You could have the AI give you a guide and then say, actually, like, I want to use this guide for a residential treatment facility. Like, I want it to be targeted for that patient population and maybe, or sorry, that caregiving population. Or you could say something like, these are the main areas that I'm concerned about. I want to make sure these are highlighted in that. And the AI will make those changes. Now, in terms of the second question is more, or the more detailed part of the question is like, how do we transfer ownership or give other people access to this
Mhm.
information. And we don't have a solution for that right now, but what it sounds like something that we're working on, which is a clinician feature, which is essentially a way for us to say, are there other people in this individual's life who would benefit from access to kind of all of that information? And again, part of the complicated piece of that is making sure that we respect rights and making sure that like you have the ability to share some things and not other things, having that kind of like on-off checkbox of what you're sharing. But that seems like a similar problem to what you're describing here is like how can we get people outside of the immediate family
It's
who
a
may benefit from
partnership.
having,
Yeah.
yeah, having direct access. And yes, we don't have that right now, but it is 100% on our roadmap. I would also say like something that's fun about frankly working at Citizen is that we move quickly. So like even when I made these slides, it was like, hey, we're gonna have a app ready soon. Well, it's already here. So I always try to be cautious on when we're trying to introduce new products, but we do really take these kinds of conversations very seriously and take this feedback back with our engineers and try to figure out a way to solve these problems
Well, if
quickly.
there's one more thing I could add to it,
Sure.
I understand that the degree of trying to be very respectful and have only what you want listed in this type of a app.
Mm,
But in what I've experienced, nothing is off limits.
mm,
Because if you think there's something that isn't relevant now, it can come back and be extremely relevant in the future. And so, medically speaking, I personally would want everything on there. I can't think of anything that would in any way compromise the integrity of my son. If
right.
that's helpful in trying to give a landscape to what you're trying to put together. Because I also find that when you do limit, there is going to be a problem later down the road or a potential problem. And then
Mm,
that's when you have to restart the whole situation over again. So
right.
if somebody has a limitation in one area of medical need for whatever reason they don't want to disclose it, then that piece becomes the glitch in the future potentially for something else to move forward. So that's where I have a really hard time with privacy with this because it has held me up with getting
Hmm.
my son certain things that he is entitled to.
Right. Yeah, I think I first appreciate that comment because I think that we are trying to design something that fulfills so many different needs for people. And while we are trying to make things often as simple as possible, we do see people who are on the other side of things. And I think part of that is because um, you know, we don't just support caregivers. We have adults with different conditions that are on the platform interacting themselves. So we have this huge degree of our spectrum of patients that we're actually serving. And so, to your point, Lisa, while we want to make things as easy as possible and as we see the power of sharing this data as much as possible, we do also have to have these kind of
Right. I
restraints
can see. I can
slightly.
understand.
But I appreciate it's really nice to hear this actually from people because we spend a lot of time talking about where where the guardrails are, what's too much, what's not enough. So getting this feedback, I think, is super valuable to be able to share that with our team when we're building these types of things. So thank
Well,
you.
thank you.
Gio, I wanted to ask, like, is that, to Lisa's point, is that something where, you have the ability to share the records with a provider from within Citizen? So what I've done in the past is when we went and got a second opinion for Harper regarding her GI issues, I literally just shared all of her records via Citizen
Yes.
to the new provider. And I know that's kind of a one time, it's not an ongoing thing where it'll send smaller updates, but maybe, Geo, that's something that can be done if you do the big dump to somebody and then it kind of consolidates over time. I don't know, but that's been really helpful for us. Like, if you are going to get a second opinion, or where I hear families say, we're transitioning from pediatrics to adulthood, and now we're going to all new providers, and these people have known my child for X amount of time, and I don't want to have to tell this story all over again. You have the ability to share all those records, and you can even have the AI do summaries of things. And because we know doctors are not going to sit and read all the records, and provide them with summaries of everything so they can get a really good snapshot of your child. I
Mhm.
actually used AI uh, to help with my daughter when she started the school year, to kind of give a summary of her kind of hot button medical issues, and to help kind of list for priority wise for her teacher and the pairs in the classroom, so that they kind of had an idea of all these little nuances to kind of keep an eye on. And that was helpful.
Yeah, definitely. Yeah, the ability to share medical records is like that was kind of the original foundation of Citizen. It's only more recently that we've started to understand that we can use those medical records to, you know, make caregiving easier, right? To remove some of those hurdles, things that take time and energy. And while I would say that, like, while AI advocate is one thing, keep an eye on the space, we'll say. Like there are lots of other things that we are working on with the entire goal of saying like how can we free up time for people? How can we make caregiving you know less all encompassing? Like how can we save some efficiencies? So lots more to come, hopefully.
Another quick question is somebody saying when they sign up, it's asking for their name. Do they put their name or their child's name first?
They put their name first.
Yeah.
Yeah.
We had another family ask if there's any benefit or can they upload their child's IEP.
100%. So you can upload anything you want to the account. And I think the benefit of, I mean, IEPs are long, like significant documents. So to be able to ask specific questions, like you can 100% upload an IEP and use AI Advocate to ask questions about the IEP. I know that we had a caregiver who was having problems with an IEP being followed in school. And so they uploaded the IEP and then uploaded some additional documentation like notes that had been being received. And they said like, can you look at this and tell me where they are failing? Like where is the school missing? What are the areas where they should be doing better based on what we have in this IEP? So the answer is yes, for sure.
One other question we had, and I'm assuming this is Brian, even though it says you're Marissa. Um, that it's asking what degree does this interface with other things? So we have kind of data sets in different places, like with combined brain, with a natural history study, and whatnot. And I'll let you do your take on it from Citizen Health, but the answer from a foundation standpoint, and Brooke, you can elaborate as well, is that's why there's this important and urgency for every family to have a CRID, right? It links all that information. And like right now, we are working with Dennis Lau to kind of finalize our KCNQ2 variant database, and they're uploading information from Citizen into the back end to help make it a richer, more knowledgeable experience. So that's a perfect example of how your child's information is being linked completely around and connected. And the glue that's holding it all together is going to be the CRID. So that's imperative that you have that. And like Dennis asked for a CRID when we pushed out the phenotype survey through his group. And I think
Mhm.
one of the other things you had is talking about information like your daughter's milestones and stuff. I had actually gone a long time ago and have Harper's milestones written on a sticky note. So I just took a screenshot and uploaded it into Citizen. And so now I have all those important dates because maybe those inch stones weren't important to the doctors that I told them to, but they were very important to me. And I wanted that captured in her record.
The other thing I don't think I've mentioned about AI Advocate, like you could ask it that question, like pull out all of the motor developmental milestones from the medical record. And not only will it do that, but it also provides sourcing. So it tells you where these data points are coming from and allows you to go and click on that medical record and say, oh, yep, that's where it says that. Because even medical records aren't perfect. Like there can be mistakes in them, and you may be able to actually see some of those things by actually asking questions about the medical record.
And then maybe if I can sort of ask and elaborate here, because yeah, I was, wanted to mention the portal as well, which Scotty did a great job of calling out. And that's where we actually we're utilizing citizen health data in that portal to kind of visualize some of the phenotypic information we were able to draw out from the multiple community members who have sort of sourced the data. But it sounds like if I'm understanding correctly, like Scotty is saying, you have an ability, the individual has an ability to upload things beyond medical records, right? And so, yeah, if someone was to fill out a survey and it has all the answers, that can then get uploaded, right? And then it holds that there for you. When we get the data extracted from Citizen, does it extract everything an individual has within their sort of data source, or are we currently just extracting the medical health data?
That's a good question. The abstracted data sets that you are receiving are based specifically on the medical records.
Okay, that's what I was
Uh,
kind of figuring. Yeah.
yes.
Yep. Yeah. So to Scotty's point, crid, because I mean, and I know the effort it takes to fill out all the surveys. and to also be tracking everything you need to track in a place like Citizen. But having your data in Citizen and then going out and doing that survey and using the CRID in both places, it allows it to be linked when we want to, create that digital natural history study, give information to a pharma company who's coming to ask us questions about the disease phenotype, right? So, this work is greatly appreciated, and it is incredibly powerful, and it is even more powerful the more closely you can link all this information. So, we'll keep talking about CRID until we're all blue in the face in that. But also, like, obviously, Citizen, with its wealth of the medical health, is a great place to start. And then as surveys and other things come in, we'll also encourage you all to participate that as time allows.
Thank you, Brooke. And any other questions since we're getting to kind of the end of our time? All right. Well, Gio, I can't thank you enough. I mean, this was super helpful. I love that you're, helping our families better understand how they can do it. And one thing that I really saw is like several families commented like, oh, I go and, ask Chat GPT all this. I mean, think of this as like your child's own personal chat, right? Because it's pulling directly from their medical records. So it's not pulling from like general KCNQ2 stuff that it's finding on the internet. It's literally pulling, your child's specific and individualized data. And I know my husband and I have personally used it when we were having conversations with a pharmaceutical company, about our daughter. And we went through and used the AI advocate for that. And it was amazing what it was able to generate, questions it asked, prompts. It was beyond helpful. So I just kind of encourage people to think of it in that manner.
And let us know if you find really cool ways to use it. Like, we love that feedback because we tried to design this with specific intentions and specific questions, but the more we see people use it, the more we're like just incredibly impressed at the ways that people are trying to expand its uses. So please share them if you have any great insights.
Yeah. Anybody has any questions or feedback, reach out to Citizen. Feel free to reach out to Brooke or myself. We're always here. All right. Thank you, everybody.
Thank you so much, Gio. Hopefully you saw the new naming that was presented in the
Oh,
chat. Geo Beak, the Gene Geek.
I
So
love it.
I hope you start a YouTube channel with that someday.
Yeah, when I'm a famous YouTuber, I'll
Think of
remember
us.
this. I'll remember this webinar.
Think of KCNQ2. Excellent.
thank
Thank you.
All
you,
right.
everyone.
Thanks, everyone.